going to go over dental procedures. First I am going to explain all the instruments that are used in a dental, and then what they are used for and why. And so I will start there. Here I have all of my dental instruments, and as far as I will start off with I've got luxators here and elevators. Here would be a luxator, and then here is an elevator. What elevators are used for is to help cut or break down the periodontal ligament, and that also helps it holds the tooth to the alveolus, and as far as that just helps them pull all of that away from that tooth, where it makes it easier for extraction. This is a luxator. It does about the same thing as far as just helps to break down the periodontal ligament and which holds the tooth to the alveolus. And as far as, let's see, right here, we've got some extraction forceps. I've got two different sizes here, and this just allows them to grip onto the tooth better. So as far as they're just able to hold on to it all better to extract the tooth after using the elevators to loosen the tooth up for them. Next I have my scalpels, or not scalpels, the scaling instruments. Now this side is the Dental Explorer. This they use this on the tooth for just to kind of explore, make sure there are not any pockets that could be cavity driven. Also, then the other end here is the probe. What it does is it helps to measure to where the pockets and there isn't anything that the doctor needs to be concerned about. These are the scalers, and here is the scaler, and what we use this for is to kind of just scale along the tooth here, trying to get any debris, the calculus, off of there, and they just go over every single tooth. Just their end here is another, like, it's the curette, and what it does is it just helps to kind of get underneath the calculus there to just get a better grip at it, to try to pry all of that off of there. Okay, I do also have, these are for the mouth. What this does is this helps to open up the mouth for the doctor. That way they don't have to have someone hold the mouth open. It kind of just frees up some hands for everyone, and that just holds the mouth open. They're able to get back there pretty well and work on what they need to do. Things that we use as precautionary are, during a dental procedure, should be wearing a mask. That is going to prevent us from ingesting any kind of contaminant that maybe we shouldn't, or from spreading anything that we should not be. As far as goggles are a good thing. I mean, we've got bacteria is in the mouth and kind of flying around somewhat. We don't want that to get into our eyes or our mouth, so just to protect us. As far as we should be wearing gloves during a dental procedure. Again, that's just ensuring we are contaminating the dog's mouth, we are contaminating us. And then as far as, we do use towels under the patient's head or the neck area, and that's just to ensure that the water is not fully going down into the animal, causing them to possibly aspirate if that were to happen. One thing I will state as far as with the probe is anything 3 and above is normal for these teeth. And as far as everything, I am going to perform a cursory examination of this dog for dental. As far as I am kind of evaluating her head and neck, making sure she looks like she's in good, healthy, checking her lymph nodes and her salivary glands. Then I'm going to check her oral cavity. And one, checking her, making sure all those baby teeth are gone, which they are, so that's good. Opening up her mouth, checking the inside, her soft palate, her tongue, and then her pharyngeal, or as far as her gingiva, looks good. And her tonsils. Here, sweetie. I know. Yeah. Those are good. And then she didn't have any fractured teeth either. I was looking all the way in the back there. Her teeth look really good. She is a young dog. So as far as the condition of her teeth, they're still pretty perfect. And she lost all of her baby teeth, so that's always a plus. And so this dog I would consider is healthy to go under for a dental if she were going to have one. I'm going to use this mouth gag to open up this dog's mouth. And her tongue out of the way. I'm going to use this as the pharyngeal sponge to ensure that water does not go down. I am going to start cleaning these teeth using the ultrasonic cleaner. Making sure I do get underneath the good line, or the gum line here, to ensure get all that bacteria out of there. When putting the probe on here, I never want to leave it in just the same spot. I always want to keep it at constant motion for 2 to 3 seconds. And the reason for that is so it doesn't create gouges in the teeth. And I'm making sure I'm getting underneath the gum line. Cleaning the whole surface of the tooth. I'm now going to rinse the teeth with water. That way, as far as I am removing any debris that I may have got off the teeth. Going to check the depths of, like, if there's any deep pockets around her teeth. Should not be deeper than 3.
Oh no, I took it off and I just left it. Oh, okay.
I'm now going to clean and polish.
She
doesn't took it off if he's going to eat it.
You might have to tap on it.
Okay, and then I'm going to just move it onto the tube here. Making sure I cover the surface. The reason we do this is just to polish the teeth very nicely after using the dental curate on there, as far as just getting all the scratches out. Thank you, Sarah.
Well, by the time I get a catheter in, my chemo already here. Did they look ready to give us money?
Okay, for Mia, she has fully woken from her dental procedure. I'm just going to kind of clean up around her face area here and make her presentable for the owner. Just cleaning her all up and making her look good. Now she is all presentable for the owner. One thing to do when an animal is going home from a dental procedure is we want to make sure that we fully talk to the owner. We want to help them to keep these teeth clean in the long run, so maybe the animal doesn't have to get a dental so close to time, or maybe if never again throughout their life. So as far as we do have a post-dental instruction sheet, on it we do have what they need to do tonight, because our dentals do typically go home that day. So as far as we have, please protect your pet by leaving the hospital by using a leash or a carrier. Until tomorrow, keep your pet quiet and confined in a warm environment. As far as just so they came from anesthesia, so as far as we want to make sure they don't potentially fall, so maybe don't let them up on furniture. Just taking every possible way to keep their pet safe. After surgery, they may not want to drink or eat excessively, which could likely result in vomiting if they were to. We say do not offer their full amount of food within, so we say usually to feed about a fourth regular amount of their meal until tomorrow. We have a red bandage on them whenever they have an IV catheter present. We have a green bandage on them for them to leave the clinic. So we do say they need to remove the green bandage from their leg after 2 hours. This is where the IV catheter was placed. And it is okay to resume normal activity after, usually after 24 hours after surgery. They can remain on their normal diet that next day, maybe feed soft or canned food, just depending on how bad the mouth was. If they maybe need to, if they had to extract a lot of teeth, then maybe feed some canned food just to help them in their mouth being so tender and sore. Medications, give as directed. A lot of times if they have had a lot of extractions, we are going to send home pain medication, so they will need to give that once daily. Extractions may experience some bloody discharge either from the nose or the mouth for the next 1 to 2 days. We say call the office. We have our phone number. If bleeding continues over 2 days, we need to know about it. As far as the sutures in the mouth are always dissolvable, we be sure to explain that to clients. And we do not want the animal, if they had extractions, to chew on any hard toys that could break open those sutures. As far as we do recheck every dental within 2 weeks. And what we do is at that 2-week appointment, if they had any extractions, we're making sure that everything is healed over the way it should have. But another reason to make sure they come in is we go over their care instructions of keeping these teeth clean. So maybe this animal never will have to have a dental again. So we go over our home care as far as brushing, chew toys that are good, or chew like veggie dent things. We have a water additive people can use, and an Oravet application people can do weekly. Things like that, just as far as to help ensure them to make maybe this dental be their one and only. We do have an important thing at the bottom here, monitor to decreased activity or appetite 1 to 2 days, may be observed. Patients may not have bowel movements for 24 to 36 hours after surgery. This is normal. However, if your pet exhibits any of the following symptoms, please notify the clinic. We do have an emergency line as far as if an emergency were to arise or they just have any questions. But we want to be notified if there is a loss of appetite for 2 days, refusal to drink water over 1 day, any weakness, depression, vomiting, or diarrhea. We want to know about it. And as far as what we do is we do have the doctor sign this form that they fully filled it out. Then we have the owner sign their signature here stating that we have went over everything, they understand it, and we have it on record that we did go over this. So next thing is the different surfaces of the tooth as far as The back of the canine here and the back of every tooth would be the distal area. The mesial would be the front of the teeth. The lingual would be the inside portion here. The outside would be the labial, and then the occlusional would be kind of the like internal surfaces areas here. And so that is the different surfaces of a canine's mouth. The reason that dental radiography is so important is it allows them to see the surface of, or not really the surface, the root of the tooth, as far as making sure there isn't any pockets that maybe the doctor is not aware of. Things that they look for are any dark crevices that is a cavity. Sometimes cavities can be in between the teeth, maybe something that our eyes can't just diagnose. So it helps you to diagnose a tooth and the overall health of the mouth in a whole different way. We're looking at roots, making sure they are nice and healthy. We don't like to sedate an animal to do a dental procedure all that often. There is a risk with anesthesia, and what that does is it helps just to ensure that maybe that animal won't have to come in for a dental for a timely amount of time. So just definitely looking for any kind of pockets, cavities, things that our regular eyes just can't see. One thing to do when an animal is going home from a dental procedure is we want to make sure that we fully talk to the owner. We want to help them to keep these teeth clean in the long run, so maybe the animal doesn't have to get a dental so close to time, or maybe if never again throughout their life. So as far as, we do have a post-dental instruction sheet. On it we do have what they need to do tonight, because our dentals do typically go home that day. So as far as, we have, please protect your pet by leaving the hospital by using a leash or a carrier. Until tomorrow, keep your pet quiet and confined in a warm environment. As far as just so they came from anesthesia, so as far as we want to make sure they don't potentially fall, so maybe don't let them up on furniture. Just taking every possible way to keep their pets safe. After surgery, they may not want to drink or eat excessively, which could likely result in vomiting if they were to. We say do not offer their full amount of food within, so we say usually to feed about a fourth regular amount of their meal until tomorrow. We have a red bandage on them whenever they have an IV catheter present. We have a green bandage on them for them to leave the clinic. So we do say they need to remove the green bandage from their leg after 2 hours. This is where the IV catheter was placed. And it is okay to resume normal activity after, usually after 24 hours after surgery. They can remain on their normal diet that next day, maybe feed soft or canned food, just depending on how bad the mouth was. If they maybe need to, if they had to extract a lot of teeth, then maybe feed some canned food just to help them in their mouth being so tender and sore. Medications, give as directed. A lot of times if they have had a lot of extractions, we are going to send home pain medication, so they will need to give that once daily. Extractions may experience some bloody discharge either from the nose or the mouth for the next 1 to 2 days. We say call the office. We have our phone number. If bleeding continues over 2 days, we need to know about it. As far as the sutures in the mouth are always dissolvable. We be sure to explain that to clients. And we do not want the animal, if they had extractions, to chew on any hard toys that could break open those sutures. As far as we do recheck every dental within 2 weeks. And what we do is at that 2-week appointment, if they had any extractions, we're making sure that everything is healed over the way it should have. But another reason to make sure they come in is we go over their care instructions of keeping these teeth clean. So maybe this animal never will have to have a dental again. So we go over our home care as far as brushing, chew toys that are good, or chew like veggie dent things. We have a water additive people can use, and an Oravet application people can do weekly. Things like that, just as far as to help ensure them to make maybe this dental be their one and only. We do have an important thing at the bottom here, monitor to decreased activity or appetite 1 to 2 days, may be observed. Patients may not have bowel movements for 24 to 36 hours after surgery. This is normal. However, if your pet exhibits any of the following symptoms, please notify the clinic. We do have an emergency line as far as if an emergency were to arise or they just have any questions. But we want to be notified if there is a loss of appetite for 2 days, refusal to drink water over 1 day, any weakness, depression, vomiting, or diarrhea. We want to know about it. And as far as what we do is we do have the doctor sign this form that they fully filled it out. Then we have the owner sign their signature here stating that we have went over everything, they understand it, and we have it on record that we did go over this. As far as with at-home instructions, one important thing is to stress to the owner the importance of cleaning these teeth. A lot of times dentals are not the cheapest thing, and usually an owner realizes that after their animal has been sedated for a dental. So a lot of times they're really on board with trying to keep the teeth clean. They never have to sedate their animal for one, or to not have to pay that kind of money again. So here is let's see which model's better. Here is a model here with, I'm just going to show you the upper quadrant of a dog. There are different ways to brush teeth. There is a finger brush people can use. There is a toothbrush, and this toothbrush is kind of neat because it's made for small dogs and large dogs, or however that animal is better with. People can even use little gauze pieces if they would like. It's not as good as a brush, but it's better than nothing. That's usually what our doctors say, is at least somewhat brushing them is better than doing nothing at all. They can also use like a washcloth, something that has some texture to it that's going to help break off everything. So as far as there are toothpastes out there available for dogs. So as far as one thing we just really stress is even starting out small, working your way up as the animal gets used to everything. So one thing you would do is you would put your finger in the side of the animal's mouth and just kind of gently brushing around, like running your finger all around that tooth as much as an owner can. Just really trying to get above, or like right on the gum line. That's where the most plaque and tartar is going to build up. So that is the most important, is to try to get all of that to stay off of that gum line where that likes to build up. And then as far as, so they can do gauze, they can do a toothbrush if they would like, just getting in there and brushing along the gum line there, putting toothpaste on it, maybe doing toothpaste after they're done. We do have toothpaste that has like enzymes in it, so it's good to help try to keep that plaque and kill all that bacteria off of their teeth. And then, so just really, I mean, we tell an owner, just clean as good as they can. Once a day is ideal. Once a week is doable. So as far as the more they do it, the more it's going to guarantee that that animal does not have to come in for a dental ever again. Or at least not getting teeth extracted. So as far as you just put your hand in there and just rub along the gum line really well, trying to get all that plaque and tartar from building up on there. I mean, rubbing the whole surface of the teeth. I mean, it's harder to get inside of the mouth. In my opinion, it'd take a very special dog to get up the inside of the mouth, just because dogs don't like to hold their mouth open too much like that, especially with someone's fingers in them. So just really, I mean, going along the incisors here at the front, making sure like little pieces of hair get out of in between the teeth. Those sometimes build up and can cause more plaque and tartar. Just things like that, and trying to keep infection and trying to keep these teeth as clean as possible, as long as possible. As far as a dental record, here is what we use in our chart. This particular animal has never had a dental, so nothing is written in this chart. Now, as far as sometimes a doctor does write in this chart without having a dental, let's say if this particular animal didn't have all of her adult teeth. And so what they do in that case is they put a circle around the teeth. That way that they know that that animal did not have that particular tooth in their mouth. Now, as far as during a dental procedure, they are going to check all of these teeth. The maxilla is the upper portion, the mandible is the bottom portion. So what they're going to do is, if let's say they remove a tooth. If they remove a tooth, they're going to put an X on, let's say this molar is going to be removed. So they're going to put an X on that tooth, indicating that it was removed during a dental procedure. We also write our dentals up here. That way we know that it was indeed, there's an X on that because it was a dental procedure. So it has every single tooth on here. You've got your incisors, you've got your canine teeth, your premolars, and then your molars are back there. So as far as anything different, now as far as there are lots of different formulas for to record the teeth. So let's say if if an animal has an abscess, if let's say that canine tooth, or let's say a molar is abscess, because I feel like we see that a lot more with the molars than the canine teeth, but maybe not. But anyway, so an abscess tooth, we're going to say that that molar has an abscess. So what we're going to do is going to indicate an A above that molar, right around there. And that indicates for later on down the road, let's say maybe an owner just wants to be refreshed on what exactly happened to that tooth, then we can tell them there was an abscess in that tooth. That's why it was removed. So but there are different ways to record what is going on with that tooth. So as far as this is kind of like a cheat sheet on that, on what could be going wrong with the tooth. So if there's a periodontal pocket on that tooth, well then we're going to indicate a P on that diagram. There could be maybe after cleaning the teeth, there's some staining there that we weren't able to get off. Well, then we're going to indicate that there was some staining still there. And that way, that's going to help with the owner too, if maybe they get their dog and it's like, hey, these teeth aren't pearly white like she thought they would have been. Well, for some reason, there's some staining that is just not able to get off. Gingivitis. If there's gingivitis on the teeth, we're going to indicate that. We can also indicate some of these things whenever they are not under a dental procedure, we could indicate this during just a physical exam, stating maybe why they need a dental and that sort of thing. As far as I'm going to indicate the different teeth on a dog model. So as far as back here, you have your molars that are there. These are considered your premolars. Your canine tooth, which this particular model is missing that canine tooth, but the canine tooth, actually here I'll show you on this side, it is the longer, that's kind of the like just the longer teeth that stick out that are kind of like your biting teeth. As far as here are some incisors on this particular model, and same at the bottom. You've got your molars down here at the bottom, got your premolars here, and then you've got your canine tooth that is missing on this one, and then your incisors. So those are the different types of teeth on a dog model. Okay, as far as another important thing is knowing how to discuss the dental formula that is required in veterinary dentistry. So as far as here, I have the dental formula chart. We have the dog formula. So I indicates incisor, C indicates canine teeth, P indicates premolar, and then M indicates molar. So, and also they do have it like I 3 of 3. Well, that's going to indicate, I'll show it on this model, it's easier. It's going to indicate as far as which tooth you are talking about. So we've got 2 molars, or like 3 molars there, so it's going to be molar 2 of 3. Maybe is an issue. Premolars, you've got 3 of 3, because we've got 3 premolars there. In this model, like as far as the canine tooth, so canine is always indicated 1 of 1, because there's only 1 canine tooth on each side. And then your incisors is 3 of 3 as well. So this is just indicating like one basic side of the mouth. It's not indicating the whole side. So that is how we would document things, as far as kind of maybe not by numbering the teeth, but it's going to just help break the teeth down to better know what you're talking about later down the road. One more thing I will indicate on that subject is as far as you've got your primary teeth and your permanent teeth. So your primary teeth is going to indicate puppy teeth, and puppy teeth usually they have about 28 teeth. And then permanent teeth, that is when the animal is full grown and adult, and they are going to have 42 teeth in all. So that is the dental formula that the veterinary dentistry goes by for naming dogs' teeth. As far as here is the cat formula chart. You've got your primary teeth, which is your kitten teeth, and then the permanent teeth. So as like with the dog, the incisors is indicated with an I. So there are 3 incisors on a cat. Canine teeth is indicated with a C, and there's 1 of 1. And then P is indicated for premolar, and there are this one indicates 3 of 2, so that's pinpointing a tooth. And then as far as same with your permanent teeth, I is for incisor, C is for canine tooth, P is for premolar, M is for molars. So as far as that is just indicating another way to indicate which tooth is which that a doctor is talking about. As far as oral nasal fistulas, here is a few oral nasal fistulas as far as they can acquire on the soft palate, but most commonly we see them kind of on the side like that. and it does indicate ways of fixing them. Could be caused by a canine tooth getting removed, things like that. As far as the reason they have showed up is kind of, or most commonly, it is between the nasal and oral cavity caused by trauma or disease. As far as the most common is after a dental extraction, these can show up. The way to make sure that these don't happen is to make a very well designed mucosal flap. That is going to help to really seal up the hole to where that hole cannot develop later on. Really bad periodontal disease causes these type of or nasal fistulas as well. Calculus is when a big kind of concrete portion really builds up onto the tooth. Over time, the teeth are going to build up tartar and bacteria, and as that tooth has maybe not been cleaned, that sort of thing, it's just going to keep building up, building up, building up. That calculus can build up and get so thick that it acts as concrete, we always say, but then it's like it'll just pop off of there sometimes, if you're lucky. Sometimes it takes a big dental cleaning and using the forceps to really break that off of there.
We have a charter, please. Thank you.
That is what calculus is. As far as periodontal disease, there are different forms of periodontal disease. That is where there can be a lot of gingivitis created there. So here is like gingivitis. That is where there is a line above the tooth there, and that can be, a lot of times we see that redder than what that is showing. There can be gingival hyperplasia that can show up on those teeth. There can be gum recession that happens with those teeth, where the teeth are just so bad that the gum, it's like it's trying to get away from the tooth because it knows that bacteria and that tartar is bad, so it wants to get away from that tooth. And in turn, it kind of hurts the teeth in the long run. So there are different sizes. We have a 1 to 4 grading scale that we use. So I would say that is a grading of 4, but then 1 would be it isn't as bad. As far as here are a few different types of fractured teeth. So as far as here is a crown fracture, so the necrotic pulp is exposed there. So you can see it's kind of right at the gum line there, which so it's like this animal probably needs some x-rays to determine if that goes below the gum line. Probably going to have to take that tooth out. Here is a canine tooth that has pulp exposure because of the type of fracture that was. So that is the nerve is exposed, and that tooth needs to be filled because that is both of these are very painful. As far as there are, they can get slab fractures in their molars, and that's kind of where there's just like this hint of crack right in the molar, and sometimes you can't even see until you do a radiograph of that tooth to determine that. As far as worn teeth, things that can cause the teeth to be worn down are is a lot of times if the incisors are really worn down, maybe that animal has very bad allergies, has had fleas for a long time, because they will wear down those teeth just chewing on themselves. The canine teeth can be worn down over time just from chewing on bones. Sometimes they're cage chewers, and a lot of times if they're cage chewers, it's kind of interesting because you will see that there's like there's silver on those teeth too, and that's another indication that they've been in a cage chewing. They can wear down their molars in the back if they are very aggressive chewers on bones and things that just don't give, which we don't normally recommend those kind of bones like that, like as far as your meat bones, your what is it, like they have antlers out there for animals to chew on, they have hooves, things like that. Those things do not give and can ruin the teeth in the long run, as well as cause fractures too. Also, your retained deciduous teeth. So that is when a puppy or kitten holds onto their baby canine teeth. So they're mainly their canine teeth anyways. That's the most popular one. So as far as when the adult tooth is coming down, sometimes that baby tooth should fall out. Sometimes it does not fall out. And the way you know that is a problem is if that adult tooth has came completely down and that baby tooth is still there, sometimes there's no wiggle room whatsoever. And those need to be pulled, otherwise that can disrupt that adult tooth. It can add tartar to that tooth. It's not as healthy for the animal, so that tooth does need to be pulled. As far as sometimes the incisors can stick in there too, that's not as common. A lot of times they do lose those incisors, but it's more the canine teeth that they will hold on to those, so the retained deciduous teeth for cats and dogs. As far as a tooth root abscess, that is something when bacteria enters the exposed root canal of the tooth. This can happen from the dog chewing on a bone, ice cubes, cow hooves, those hard things that we do not recommend an animal chewing on. So a root tooth abscess, depending on what tooth it is, depends on the severity of what signs it's going to show. So let's say if the tooth root abscess is on a canine tooth. A lot of times what we see with a canine tooth is we see some swelling of like right below the eye there, the whole side of the face can be swollen. The whole side of the face can even be swollen from a molar or a premolar as well. But as far as there is a lot of swelling with that, we have seen it so bad that there's been a hole right underneath the eye from the canine tooth being so. Usually animals had that abscess for a while. As far as those are tooth root abscesses, and that is considered a root canal portion. So that whole tooth we will pull out of that animal, and that's where you're going to those very deep teeth. That's where you're going to run into the oronasal fistulas, and so we have to make sure that we make a very good flap to seal up that hole that will have developed from removing that tooth.